Welcome to Indian Anatomist. Individuals who wants to perceive career in medicine are welcome to check out the YouTube channel Indian Anatomist. Next birth injury of brachial plexus is Klumpke'S paralysis or palsy. Neurologically, lesion of the lower trunk of brachial plexus is called Klumpke'S palsy or paralysis. C8 and T1 spinal nerve roots are involved. Like Erb's palsy, this palsy also caused due to avulsion, rupture, neuroma, and neuropraxia of lower trunk of brachial plexus. The main nerves affected in Klumpke'S palsy are ulnar and median nerves. Apart from loss of motor and sensory supply, Klumpke'S palsy also causes sympathetic disturbances to head and neck region. C8 and T1 nerve lesions are caused by forcible arm abduction, such as when a person falls and clutches an object to save oneself. Next is birth injury, cervical rib, or deep cervical lymph node enlargement due to neck or lung cancer. All intrinsic muscles of hand are supplied by ulnar and median nerves, so lesion of these nerve causes hyperextension and flexion of metacarpophalangeal and interphalangeal joints, thus causes claw hand. This is due to paralysis of long flexors and extensor of forearm supplied by C8 and T1 spinal nerves. Damage to 8th cervical nerve and 1st thoracic spinal nerve cause increased anesthesia along the medial side of forearm, hand, and 2 fingers. Furthermore, the sympathetic nerves that innervate the head and neck are carried by the T1 segment of spinal cord. As a result of the T1 lesion, head and neck experience sympathetic changes, which lead to Horner's syndrome. This image depicts a notable rise in the angle between the shoulder or arm and the trunk, caused by the usage of forceful traction. This increase in angle may lead to a lower trunk lesion, which is a characteristic symptom of Klumpke'S paralysis. The left picture shows a person falling from height, and using his hand to hold onto a tree or something else. In this case, angle between the shoulder and trunk is increased. Similarly, when a baby is born vaginally breech, its feet, hand, or buttock are placed to come out of the birth canal before its head. The angle between the shoulder and trunk may get bigger because the hands are being pulled on. Now coming to Horner's syndrome. This is caused by T1 segment of spinal cord lesion, or stellate or inferior cervical ganglion injuries, or cervical sympathetic chain lesions, or enlarged cervical lymph nodes, or mediastinal tumors, or carotid aneurysms, or neck malignancies. After spinal cord exit, sympathetic fibers join the cervical sympathetic chain. The spinal cord segments T1 to T6 give rise to head and neck sympathetic nerves. Sympathetic nerves climb in the sympathetic chain to reach head and neck structures. Now because of T1 spinal nerve lesion, the sympathetic innervation is lost on the affected side. Characteristic features of Horner's syndrome are 1. Anhidrosis, inability to sweat on affected side. 2. Miosis, excessive constriction of pupil. 3. Ptosis, drooping of upper eyelid. 4. Loss of ciliospinal reflex, pupil of eye, fails to dilate. Finally 5 is anophthalmos, that is sunken eye, seen on affected side. Dear students, here is a mnemonic to remember, the Horner's syndrome. Please remember the word sample or emple. Here, each first letter describes the clinical features of Horner's syndrome. Dear medicos, I hope you all understand the Klumpke'S palsy. I hope everyone enjoyed the session. Please view previous and upcoming videos. Please like, share, comment, and subscribe. Good day all.